If surgery is being recommended as part of your mesothelioma treatment, you need to ask your surgeon detailed questions about their experience, what the operation involves, what outcomes to expect, and what recovery looks like. Surgery for mesothelioma is complex and high risk, and the surgeon's experience matters enormously. Today, I want to give you the critical questions to ask any surgeon proposing to operate on your mesothelioma tumors. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But asking these questions helps you evaluate whether surgery is right for you and whether this surgeon is the right one to perform it. Let's start with the most important question. How many mesothelioma surgeries do you perform per year? The answer is critical. For complex procedures like cytoreductive surgery with HIPEC or pleurectomy decortication, you want a surgeon who performs dozens of these operations annually, ideally 30, 50, or more, not a few. Volume matters enormously for surgical outcomes. High volume surgeons have better results, lower complication rates, and lower mortality rates than low volume surgeons. If the answer is I do a few per year or I've done several over my career, that's not enough. You need someone who specializes in this specific operation. Second, ask what are their outcomes for the surgery. Ask specifically, what's your operative mortality rate? What percentage of patients don't survive the surgery or die within 30 days? What's your major complication rate? What's the median survival for patients like me who undergo this operation at your center? What percentage of your patients are alive 1 year, 2 years, 5 years after surgery? A surgeon should be able to quote these statistics. If they're vague or say outcomes are good without specifics, that's a red flag. Experienced surgeons track their outcomes and they can tell you exactly what results to expect. Now, before I go on, I'm going to take a break and ask you a favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. All right, the third set of questions is, am I a good candidate for this surgery based on my specific disease characteristics? Ask the surgeon to explain why you qualify or don't qualify. What about my case makes surgery appropriate? What would make you decide not to operate? For peritoneal disease specifically, ask, based on my imaging, do you think you can achieve complete cytoreduction, which is removal of all visible disease? What's your peritoneal cancer index score or estimate of tumor burden? If you can't remove all my disease, would you still recommend surgery? Complete or near complete cytoreduction is essential for good outcomes with peritoneal surgery. If the surgeon can't remove most of the tumor, the operation probably isn't going to help. The fourth set of questions has to do with exactly what the operation involves. Say, please walk me through what you'll be removing and reconstructing. How long will the surgery take? Will I need blood transfusions? What organs or structures might need to be removed? If you're dealing with HIPEC, ask which chemotherapy drugs are going to be used and for how long you're going to be under. Understanding exactly what the surgery entails helps you make an informed decision and prepare yourself mentally. The fifth set of questions are about risk. Every surgery has risks, but mesothelioma surgeries are particularly high risk. So ask about the risk of death during or shortly after surgery, the risk of major complications like bleeding, infection, blood clots, heart attack, stroke, respiratory failure, or kidney failure. The risk of surgical complications specific to the procedure for pleural surgery should prolonged air leak or lung complications, and for peritoneal surgery, bowel complications or fistula. The surgeon should be honest about risks. If they minimize risks or make surgery sound simple and safe, that's a concern. These are major operations with real dangers. The sixth set of questions should be about recovery. How long will I be in the hospital? Typically, how many days? How much pain should I expect, and how will it be managed? When can I eat normally again? When can I get out of bed and move around? Will I go home or to a rehab facility? And what restrictions will I have at home? When can I return to normal activities? When can I drive, lift things, exercise? How long till I'm fully recovered? Recovery from mesothelioma surgery is generally lengthy. It's often weeks in the hospital and months before you feel normal. You need realistic expectations. The seventh set, what happens if complications occur during surgery? Ask, if you find more disease than expected or you encounter unexpected problems, what would you do? Would you abort the surgery or proceed? How do you handle complications? The eighth set of questions has to do with how the surgery will affect other treatments you may be receiving. Will I be able to still get chemotherapy or immunotherapy after surgery? How long after surgery before I can start those treatments? Will surgery delay other treatments so much that the disease might progress? Surgery has to fit into an overall treatment plan. If post-operative recovery delays chemotherapy for 3 months and your disease is aggressive, surgery might not be the best choice. The ninth set of questions is about the alternatives to surgery. Ask, what would outcomes look like if I had chemotherapy or immunotherapy and skipped surgery? Why do you think surgery plus other treatments is better than non-surgical treatment alone? What would you recommend if I were your family member? Don't let a surgeon pressure you into surgery without considering alternatives. For pleural mesothelioma especially, non-surgical treatment might be just as effective and have less risk and burden. The 10th set of questions is, what happens if I choose not to have surgery? Ask, would you still care for me, or you refer me to someone who can? And what treatment would you recommend instead of surgery? You should never feel abandoned by a doctor if you decline surgery. For peritoneal mesothelioma patients specifically, additional questions include, have you trained at centers known for HIPEC like MD Anderson, Washington Cancer Institute, or other high-volume centers? Are you a member of professional society focused on peritoneal surface malignancies? Do you attend conferences and stay current on latest techniques? What's your approach to NIPEC, which is normothermic intraperitoneal chemotherapy after surgery? For pleural mesothelioma patients, ask, why are you recommending PD versus EPP or surgery at all, given the MARS-2 trial showing EPP didn't help? How do your outcomes compare to that trial? If you're recommending EPP, why do you think it will benefit me specifically when research suggests it doesn't help most patients? Questions about the hospital and facility include, how many mesothelioma surgeries are performed at this hospital annually? Is there a dedicated ICU team experienced with my surgery? What's the nurse to patient ratio? Are there physical therapists, nutritionists, and other support staff experienced with mesothelioma surgery recovery who will help me? The entire center's experience matters, not just the surgeons. Practical questions include, will I have a chest tube, a feeding tube, a catheter, or any other tubes after surgery? And how long do they stay in? What can my family expect in terms of how I'll look and feel after surgery? Can my family stay with me? And what support will they need to provide at home? Family members often provide significant care during recovery, and they need to know what they're signing up for. The final question is as important as all of those I've already mentioned. It's, Can I speak with other patients who've had this surgery with you having performed it? Many surgeons can connect you with former patients willing to share their experience. Hearing firsthand accounts will help you understand what surgery and recovery are really like. To review, critical questions for your mesothelioma surgeon include: how many of these surgeries do you perform a year? What are your outcomes, your mortality rate, your complication rate, your survival statistics? Am I a good candidate based on my disease? What exactly does the operation involve? What are the risks? What will recovery look like? How does surgery fit with my other treatments? And what are my alternatives? Why is surgery better than non-surgical treatment? And can I talk to other patients who've had this surgery? For HIPEC specifically, ask whether they can achieve complete cytoreduction through surgery, and don't accept vague answers. Demand specifics. For information about mesothelioma surgery and finding experienced surgeons, you can visit mesothelioma.net or call 1-800-692-8608 or use the live chat feature to work with one of our patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.